Welcome in, everybody. Welcome to the Mental Health Hour. This is episode 59. We are talking tonight about the importance of medication. Gemma, how are you?
Um, Not too bad. Not too bad. Plodding along. It is week 1 of the 6-week school holidays, so I am most likely better now than I will be in a few weeks. But other than that, hair all still intact. So for now, I'll be tearing it out no doubt in a few weeks.
Excellent. We got Uncle Rick in the house.
Hey
Tracy.
Rick. Hey
Hello,
Tracy.
Terry Fox. Welcome to the show. Always great to have you guys along for the ride. Um, Wanted to jump into medicine tonight. This show, I wanted to talk about how the medication that we take, the importance of it, um, and staying on top of it. Uh, so let's dive in. And I apologize because as soon as the show started, I got frazzle brained and all my notes went sideways. But it's okay. We will take a step back and reset. Um, let's start with depression
Mhm.
because that one is one of the biggest problems that I have
Yeah.
currently, as well as anxiety.
Hmm.
These two go hand in hand. Okay, so depression and anxiety, they work together. They go hand in hand. Um, uh, as far as the medications go, uh, I've on, and I don't want to say a number, but it's upwards of about 6 pills,
Hmm.
6 pills for depression and anxiety.
Hmm.
Um, that comes from trying to um, get everything in order. So I guess we need to start. We just jumped right in, and I apologize for that. Maybe we should back up a little bit and start over. So let's talk about medicine from the depression side of things, anxiety. We need to get an understanding first. Gemma, can you go through that, please?
Yeah. So medication assisted treatment, so it's MAT 101, is oh my gosh, this is a good start. Innovative, pioneering program, but what exactly is it? So M for medication. Medications include methadone, naltrexone,
Yep.
and buprenorphine, and are given to the inmates. A, assisted. The medication assists by curbing opioid cravings, allowing inmates to focus on reentry and rehabilitation. And then the T treatment, like with anxiety, cholesterol, or high blood pressure, the medication is part of an overall treatment plan to help manage symptoms.
Exactly. And then we're going to bounce over to this one.
Just going to bring it up on here. So, again, medication assisted treatment. MAT uses medication in conjunction with counseling and behavioral therapy for substance use disorders. So, the effectiveness of MAT. MAT is proven to be clinically successful as the medications provided through MAT programs help patients avoid relapse and life threatening health complications. Medical professionals use methadone, buprenorphine, and naltrexone to treat opioid abuse and addiction, medications in MAT for opioid addiction, and medications in MAT for alcohol use disorders. The most popular medication to treat alcohol use disorders are disulfiram. Oh, you've given me a belter tonight. Acamprostate and naltrexone. Oh my
No.
goodness, that was a test and a half, wasn't it?
So basically, now I was on naltrexone. Naltrexone is it curbed my uh, alcohol cravings, if you will. Um, there is medicine out there for curbing opiate uh, drug use, and we can talk for days about medicines that will try and curb addiction. However, medicate. I'm sorry. Uh, yeah, medication assisted treatment is very good as far as um, when you're working the program.
Mm-hmm.
Uh, when I was going, uh, I can't think of the words. When I was going down the road of sobriety,
Mm-hmm.
um, naltrexone definitely helped. It was one of the best drugs that I was on. Um, it really does curb that craving. I never thought once about alcohol or any addictive feeling, you know. Um, it's offered in a shot form, I believe, and a pill form.
Mm-hmm.
Um, this was my experience with it. But one other thing I wanted to talk about was uh, getting medicines interacting with each other. Um, as you can see, uh, sometimes our medicines don't work together, clearly. Um, we did an episode, what, 2 weeks was Tracy?
About 2 or 3 now, yeah.
Yeah, 2 weeks ago with Tracy. My medicine that day was not working very well.
Mm-hmm.
Um, it was collapsing. Like I felt like everything was collapsing around me. You have to be on top of these things. You have to notice these things, these signs, these symptoms. And I'm sorry, Chatter's box. Uh, I'm not seeing the comments right now because I'm on a diatribe. But you have to notice these symptoms when they come up. It's very important.
Mm-hmm.
Very, very important. Uh, more than just your your buddy at work saying, "Hey, man, I think something's up with you." It's like your whole life is out of order. You know, Gemma, have you felt any kind of way like that on a certain kind of medicine?
Yeah, I literally just started some new ones recently, actually, and it was making me really, really sickly. But certainly with getting on the antidepressants and anti-anxieties, I feel like there's so many that don't seem to get on with you, and it's trying to find the right one. But you've got to go through all the bad ones to get to the good ones, and it really can mess with you. And I remember when I was trialing quite a lot of them, and especially when I started with the opiates, and then when I transferred from the buprenorphine to the fentanyl. Oh, like, I was not even on this planet for some of it. It was horrendous.
Yeah.
And it's like, depending on some of it, like, especially with the anti-anxiety and the antidepressant tablets, for me, I just felt like they weren't working, but they were actually affecting me in other ways as well, that I hadn't picked up on it, and it was other people that were having to tell me. Like, I'd be completely zoned out, literally walking around like a mummy or something, like completely oblivious to everything,
It's
feeling
100.
very sick.
It's 100% uh, the way your medicines react with each other.
Mm-hmm.
So that's why we wanted to do this episode. It's something to really think about.
Oh yeah, definitely. It's about trying to correct like the levels within your brain to
Mm-hmm.
get you back onto an even keel with your mental health. But if it's not right for you, it can completely tip the other way and make it unbalanced to the point where you might end up being worse than you were, but not necessarily in the depression side of things, but in other things as well.
Let me go take care of baby girl, and
Mm-hmm.
if you would uh, like to dive into the
We can go through some of these other slides, yeah.
yeah.
Okay, so I have personally come off some medications and both changed and just come off them. I've come off them controlled with a doctor's help, but I also admit that in the past I've come off them without asking for help and I've just stopped dead. I wouldn't advise doing that to anybody. Don't ever just stop your medication, because that in itself can cause more problems than it's worth. And you are putting yourself at very serious risk. So always, always speak to a medical professional before you stop any kind of medication, because chances are you're going to have to be weaned off of it. You can't just stop dead. Stopping something, especially something that affects your body so greatly, can throw your body into shock and make things happen that aren't supposed to. Like, this is just some of the withdrawal symptoms. I know it says antidepressant withdrawal symptoms, but it's not just for antidepressants. This can be for many, many drugs. So flu-like symptoms, sleeping trouble, anxiety, tingling sensations, hypertension, sweating, tremors, and nausea. Now, I know that I had all of those, and with the tingling, it was also like an itching. I get it when I change my patches every 3 days. I'm on fentanyl patches that are prescribed. Had I have known back then when I was being prescribed them by the doctor what I know now, there is no way in hell that I would have accepted them. However, I didn't. So I assumed that my doctor knew what was best for me. In hindsight now, I wish I hadn't have accepted them, but we live and learn. But the sensation for me was like having ants crawling under my skin all over, itching to the point where I could have drawn blood sometimes. Now, I'm quite lucky I don't have nails as such, if you call that lucky, but it meant that I didn't really cut myself too much, but the itching was horrendous. The nausea, oh, that was horrible for me. Like, constantly throwing up, couldn't eat. Like, if I was hungry, I would eat, but it wouldn't stay. It was just horrendous. The side effects of coming off any kind of medications, especially ones you've been on for so long, that have a huge impact on your body, can have such horrific withdrawal symptoms when you're coming off them. So never just stop them dead. You need to come down off them slowly so that it reduces the symptoms of withdrawal. because if you just stop dead, especially if you're on a really high dose of something, it can completely throw your body into shock. Like, it'd be like, what's going on? Why is this stopped? And it won't know how to deal with it. And sometimes it can cause complications in your body to effectively shut down because of you stopping this supply of what it was once getting, especially if it's been for so long, and then all of a sudden it's stopped, and it can be really quite scary. We've got another one just here that is the similar sort of slide. This is common withdrawal symptoms for everything overall. However, they pretty much fit with the other one. Irritability, trouble sleeping, tremors, restlessness, depression or dysphoria, and sweating. Again, like, I remember having all of those. And it can take quite a while for your body to get back to normal, because if you think about it, if you've been taking something for a long time, it's going to take at least a week or two for it to completely get out of your system. I know when they said about Thomas stopping his chemo, they've said it will take 6 months for it to completely get out of his system and his body to start recovering. So that gives you an idea of just how long it takes. And I know when you're starting a new antidepressant, for example, they say to give it around 6 months to know that it's really working. I mean, obviously, if you're taking it and it's having a really nasty effect on you and causing negative effects, then obviously you need to speak to your doctor and potentially look at switching. But all in all, to come off something, it needs to be done very gradually, like a drop in dose. So say, for example, if you're on like 100 milligrams of something, they can drop you down by 5-10 milligrams at a time till you are on literally nothing, and then take you off. So you've just got to be doing it carefully, really.
So, please, just a PSA from the Mental Health Hour: stay on top of your medicines, stay on top of your appointments, and stay on top of your counseling sessions, because they are all solid important. So important to be a part of what you want to see. My mind goes like 15 different ways because there's so much to talk about
Mm.
in the mental health field. However, um, uh, depression and anxiety uh, are the big triggers, right?
Yeah, definitely. I mean, just to put my experience out there, like, I've tried so many antidepressants, and I think I'd found one that maybe worked for quite a while, but having been on it for so long, and then they took me off of it to change because it was starting to no longer be effective. And since then, I haven't found one that I think effectively helps me. And now I am not on any medication for depression specifically. One of the medications I take is an old antidepressant, which is used for pain, but it is an old antidepressant. I wouldn't say that I'm getting any relief from that for my depression, but I mean, things work very differently over here, and it isn't my it's not my like psychiatrist or anything that prescribed those things. Initially, some of them did, counselors, psychiatrists, whoever, but now it's my GP, and I find that certainly my experience has been that they tend to opt for the cheaper options first, so like citalopram, things like that. That's their go-to, it would appear over here, and that doesn't do anything for me. The only one that I really got some kind of relief for was Prozac.
Mm-hmm.
And then there's a lot that I was speaking to somebody, a friend that is in the US, and she mentioned a name of one of the medications that we don't have over here, and they won't prescribe it. Over here, you can only obtain it on a private prescription. I'm trying to think of the name of it now. But yeah, you can't get it over here. But I feel like when I've spoken to people from the US, it seems to be a good one for a lot of people. I'm going to try and remember the name of it. But I just want to address something that Jay asked me above as well. I know I've put it in writing a little bit, but it fits with what we've just been talking about as well. So going forward, if ever you are offered a medication from your doctor or anyone, and you don't know what it is, you are perfectly within your rights to ask for a second opinion. You are perfectly within your rights to research the drug before you put anything on your body or in your mouth. And you are perfectly within your rights to say, I need to, before I take this, get some advice on it. You can ask your pharmacist, you can ask another doctor, you can do the research yourself. I blindly accepted that my doctor knew what was best for me when I accepted the fentanyl. Going forward, it has caused me significant medical problems that have in turn destroyed parts of my body. It's caused a heart problem. It's caused further breathing problems. It's caused bladder and bowel paralysis, many, many issues, some of which they can't indefinitely pin down to this, but there is a lot that they do pin down to opioids. So going forward, I would absolutely, before I put anything further in my body, get a second opinion on it and not just blindly accept what they're telling me, because it's your body at the end of the day. You should be the one that's in control of it. And just because a doctor's telling you to take that doesn't mean you have to. Obviously get advice, and depending on what it's for, like if it's for something that is like chemo or something else, I mean, again, you want to know what you're putting in your body. But if it's something for like pain, for example, or something that there are alternatives of, maybe look into that first rather than just blindly accepting what your doctor's saying. I'm not saying don't listen to your doctor. That is not what I'm saying. I am just saying there are options out there at the same time.
Yeah.
There we go. And yeah, steroids definitely need to be slowly decreased. Thomas was on those as well.
Absolutely.
Very, very.
Yes. So the biggest thing I wanted to discuss about this is how fucked up you can get from your medications.
Mm-hmm.
Contradicting each other. All right, Gemma,
Yep.
can you
I will talk about some stuff to do with that. Yes, you go sort the little bit out. So Tim wanted to touch on making sure that your medications don't clash. There are certain medical books, like I know there's one that I have, BNF, British National Formulary, and the doctors and things use those here. You can obtain them yourselves as well. There are some, even in the leaflets that you get inside a pack of medication, I think I have some here, and you will always get, yeah, this is an anti-sickness, I think, for Thomas. Yeah, this is an anti-sickness, and inside the packet you will always get a leaflet. Even if it's one of the pharmacy white boxes, you will always get a leaflet that is inside of it, and it will tell you on if there is anything that you should definitely not take. I have been given medications that contradict each other. don't expect your doctor to always look up what you're on, because mine certainly didn't. And it will tell you on the leaflet the name of the drug. It's usually the brand name, the drug name, any warnings and precautions. There's everything on it. And one thing that I advise to do, if you're on any medications long term, especially, carry something with you that if God forbid anything happens and you're out and about and you are unable to talk and tell people what you're on, even if you can, you don't always remember what it is. Carry something with you that tells a medical professional what it is you're on. I've normally got a really good example of it. I've taken it off, a medical bracelet with a card in my wallet, and that tells them what I'm on. But every medication's got some form of leaflet that will tell you everything about it. Just check if it's a new medication that there isn't something on there that you're on, because even though doctors are meant to have your full medical history and everything, and it's all supposed to be on there, what you're taking, it isn't all. They don't always check. I've certainly found that. And it doesn't hurt to just double check yourself before you take anything. Before you put anything into your body, check it. Because it's you that's going to be having these effects, you that's going to live with these effects. So it won't hurt to check it. Ask questions if you're not sure. Because at the end of the day, it's a lot easier to ask questions before you take it than it is to ask why when you've taken it, if you've had the problems. So every medication should have some form of leaflet with it. If you get, like, say this is a box of 28, if you are prescribed, say 10, for example, often a pharmacy will give you like a white box or something. If it hasn't got the leaflet in it, ask for it. I'm assuming that's the same across the board, but everything has always got some sort of information in it. But then you can also look it up online. Just make sure it's a reputable website that you're doing it on. Things like that. But you can ask the chemist as well. You can ask your pharmacy, and you can always go and ask your pharmacist for a medication review, see what you're on, tell them what you're taking, and just make sure that it all is supposed to be taken with each other. Some will say don't take at the same time as, like, I've got one that says do not take at the same time as any indigestion medication. And then some of it will say take on an empty stomach. Some of it will say take after food. So make sure you're doing what's right with the medication as well. The more you're on, the more difficult it can get. But once you get into the swing of things, then it becomes more easy to do that. You back?
I'm back.
Very good.
So you're crushing it. I thank you. You're crushing it. That is true. I mean, I really want people to take from this podcast the biggest message about medication is to watch what chemicals are going in your body.
Mm-hmm.
Because sometimes that shit fucks you up, man.
Oh yeah.
I'm not gonna lie. Like, look at the episode with Tracy. I was on a new medicine, and it was not feeling, it was not mixing well with me. So
yeah, you could tell you were not yourself. It doesn't hurt. Like, even if the doctor says to take it, it doesn't hurt to check before. Because as I said before, it is a lot easier to check before you put it in your body than it is to check what's going wrong once it's in your body.
Yeah.
Because it can really cause a whole heap of imbalances and troubles that you wouldn't have even dreamed of just by taking one medication. It really can mess you up from being completely spaced out to causing very, very quite severe problems.
So I did want to tell a story
Mm-hmm.
on this episode. Um, I was working at the firehouse. Um, I had just started. Uh, so this was back when I was uh, still not. I was still drinking, but I didn't want to admit that I had a problem. Um, so I tried some medicines and what have you, and the chemicals did not work well together. Anywho, long story short, uh, I was working one day and uh, my medicines that I was on were making me very sleepy. I uh, I went home from work. I stopped working that day, and I went back to the doctor, and we had to make some adjustments and uh, get things straightened out and correct. Because you can't. Not everybody's body is the same, and not everybody's body is going to accept the same line of medication.
Mm-hmm.
So it might be a little bit of shopping, as I was talking about before. Penelope interrupted us. Uh, you got to shop it out. Um, you have to shop it out just like your counselor or your doctor. Your medicine is so important. Gemma, do you agree?
Oh yeah, definitely. Um, they, I remember many different occasions where I've had horrific side effects. Um, when I started, it's funny actually. When I started this new one just a few weeks ago, one of the side effects of that was tiredness, excessive tiredness, and I was stood in the kitchen. I was going to make myself a drink. Yeah, she does not want to be put down. She's like, nope, I'm quite happy here with you. And bless, she does not want to be put down. She likes being on the screen. I think she likes being on her daddy. But yeah, I was stood in the kitchen making a drink, and the next thing I know, I'm being woke up because I'd fallen asleep, stood up, and headbutted the cupboards in front of me. And that's why some of them will say, like, do not operate machinery, do not drive, because they can cause excessive tiredness and things like that. So it's hard, and especially in the first few weeks and months of getting used to medication, it's trying to know whether it's an effect that's going to go away when you get used to it, and whether the pros outweigh the cons of taking it and bearing with it, as to, is this going to be a complete and continuous issue that is going to affect my life, where I really need to come off it and change it, because they do say to give it so long to get it into your system, to get used to it, so that it can help you. But at the same time, you don't want it to affect you to the point where you can't function at all. Yeah, it's hard because everybody reacts differently. It's definitely not a one size fits all for certain medication, like pain relief, something you simple pain relief medications. Like, just for example, um there's I can't remember what they're called in America now. Like paracetamols, your ibuprofen. What's it called? What's your pain medication called over there that you can buy over the counter? I'll know it if you say it.
Say it again.
Pain medication that you can buy over the counter there. What's it called? Like paracetamol, ibuprofen. What's it called?
Morphine.
No, it's a. Gosh, what is it called now? I've heard people mention it. Tylenol. That's it. There we go. That's the one. Thank you. That's the one. Thank you. Um, And I was shocked when I was in America about the things that I could buy over there, actually. Because I was able to buy, oh dear, which is it again? There was a drug I was able to buy over there, which you can't over here. But then I was also able to buy melatonin over there. And over here, melatonin is a controlled prescription drug. You can't get more than 2 weeks at a time if you're lucky. And I had to go through absolute hell to get Thomas to get the melatonin. And yeah, we will let you buy codeine over the counter here. It's the 8300, 8200 strength. Yeah. 8100 cocodamol. Yeah. But when it comes to pain medication, like the Tylenol, the Advil, for me, because I'm on such a high dose of other pain medication, that won't even touch me anymore. Like, I get no relief whatsoever from that. Yet somebody who's not used to taking pain medication, it will probably help them depending on the type of pain that they have. And that's what we say about everybody's different. Everybody's got different pain thresholds. Everybody's got different tolerances to different medications. Whereas some people have, you can be absolute outright allergic to some things, and then you can be where you can't tolerate it or your body can't break it down properly, and you can react differently to it. And it's about trying to find something that works for you that doesn't coincide with anything else that you're taking at the same time, because the last thing you want to do is take something that's going to throw everything else off balance. And usually, I'm not saying this in all cases, but if you've got a physical condition like I have, Ehlers-Danlos syndrome, and that will come and throw other complications in, like I have a slight, very, very slight heart murmur. I've got Crohn's disease, colitis, asthma, or COPD, and it's trying to get all of those conditions, making sure that everyone's treated in the way it needs to be, but one medication for one thing doesn't affect the other medications for the other thing, if that makes sense. Give Tylenol like candy. Yeah, they used to do here, like it's paracetamol here, and they used to give it like loads here, but they're clamping down a little bit now. It's like antibiotics. They used to give loads out here, and now they're realizing there's a resistance to antibiotics because of being overprescribed. And they're trying to claw it back now, like be like, oh dear, we've given that much out. Now people are building a resistance to these medications, which you can do when you're on something for so long. Your body becomes used to it and you build up a resistance to it, which is which like when Tim said about how he'd been on an antidepressant and they changed it, probably because he'd been on it that long that his body had built up a resistance to it. And that's the same with a lot of medication. If you're on something for so long, your body can build up a resistance to it where you need more. Like me with my pain relief. When I started the patches, I was just on the one, and it was a lower dose. And now I'm on more and more. And it's got to the stage where what I'm prescribed isn't enough anymore. And I have said that I want to come off these patches, but at the same time, I don't want to be left where I'm just in loads of pain all the time. But it's trying to find something that's going to help make sure I've got some quality of life, not space me out, not like make sure I'm not in complete agony, but not give me any more nasty side effects or anything. And like, hang on, I'm just checking the comments. 5 milligram and 10 milligram. Yeah, so you can buy melatonin from the grocery store, like here. No, I can't. Like, I know when I was in America on holiday, I was surprised at the amount of things you could buy there. And then over here, it's a no-go. It nearly came to me then, the medication that I was able to buy. Yeah, I'm on a prescription for it here. And I can't think. Many people forget to tell their doctors what supplements they're taking, because even certain kinds will cause your prescription medicine not work correctly. Yeah, that's true. And like even just vitamins and things. But then there's when you go down the self-medicating route as well. Like over here, I can only comment over here, such as cannabis is illegal. It is an illegal drug, and you can be in very serious trouble with it if you have it. However, in recent months or so, they have started prescribing it to certain people. But people that will take that, for example, that it isn't prescribed to, if you are on other medication as well, then it can have a really serious effect on you. And even stuff you can buy, even paying medication you can buy over the counter, can affect what you're already taking. So you must make sure you tell your doctors what you're taking, so that they can make sure that you're on the right things. And if you need to stop taking something that you're administering yourself, then they should be able to tell you.
Oh my goodness.
You're having fun tonight.
This has been the worst one yet.
Yeah, she was having none of it.
Oh my goodness.
You were quite confident earlier as well. I said,
Oh my God.
I said, don't jinx it.
Now, can you tell me how that baby girl? Can you hear?
Yep.
Isn't that something? Can you
He's
tell
like,
me how that baby girl can be so happy for 5 seconds and then
she was perfectly fine and alive.
I love her to death, though. I love her so much. Oh my goodness.
It does. It's hard at times. It really is. I remember it well.
Guys, I apologize. These will be back to normal again.
Yeah, that's the thing about kids. They're the boss for
They
many,
are
many years. Like Thomas will be 9 in September. And now he doesn't cry, but I know that when he comes into the room, like you saw it earlier, and he was like, "Mommy," I thought, "Hey, what's this going to cost me?" I just knew it. Like, he's got a certain tone about him that when he says "mommy" in a certain way, I just like, right, this is going to cost. So, and I remember saying to myself, I can't wait till Thomas can start walking and talking. And then when he could, I'm like, I wholeheartedly take this back.
Had deep breathe him.
Back now. Because he never shut up. He never shut up. He was all over the place. I couldn't keep on top of it.
All right. So this was a disaster of a show. But we still got your mental health hour in.
Yeah. And I'm pretty sure the message got across still. Even with assistance.
You know what? I would like to do a short I'll get back on top of these shorts. Do you hear Penelope?
Yeah.
I would like to get back on top of the YouTube shorts, whatever we were doing there. Do a talk on this medication stuff. This is very important. It's super important, and I'd actually maybe like to revisit this episode maybe later down the road. But as you can hear, I'm
I don't
needed.
know, maybe a guest could come on and talk about medication if anybody wants to be a guest on the show that is familiar with medication. Other than Penelope.
Oh my goodness. Let me go get her.
I should really start shouting the shows out. But yeah, thank you for putting these on because I can never remember. So it is Catalyst Wednesday today with Jim, 11 p.m. Eastern Time, 8 p.m. Pacific. And that's like 4 UK time.
It is not even
Oh, hey,
remotely close to bottle time.
so where are we?
It's not even remotely
There we go.
close to bottle time. Look at this lump of coal.
There you go. She's got her own way. She's perfectly quiet.
Episode 59, Penelope.
Wrapped right around there.
Mhm.
Wrapped right around that little finger. And she will have forever, for years to come.
Hmm.
Oh, she's definitely the boss. Bless her.
All right, guys.
I've done the I've kind of shouted out Jim's Catalyst Wednesday.
Yes.
I'm just gonna go through the others real quick.
Yes, we've got Catalyst, we've got Beardo Weirdo, we've got Ray of Sunshine, we've got Ella, the bunny mom.
Yeah.
We love her. We love her, love her.
Bunnies.
Love her, love her. Love her, love her.
I heard my bathroom.
It's just one of those days.
Yep. I'm sure there'll be many more of them.
But hey, this is what the mental health hour is all about.
You've demonstrated so many topics that we have discussed on the mental health hour right here for everyone to see. Many. Sleep deprivation, patience, so many things. And yeah, like a real quick serious note, like there's no way I think that you could have done that until you sorted your own mental health out because it gets really stressful, especially when you're on your own with a child.
Yeah.
So to have sorted your own mental health out like that,
there's
like,
no goddamn way I would have been able to do this.
no.
But I love every minute of it. What did I just do?
Yeah, not guilty. So if you've done anything, it wasn't me.
Oh, good. I have loved every minute of this sobriety trip, and she is just, I can't even describe my words right now. I got everything I ever wanted right here.
And you deserve it. You've worked so hard to overcome all that. And I bet if you think back, there's no way, if you thought back to how things were, that you would have thought then that you would be holding your own child at this stage.
Yeah. It's a crazy thing to be.
Life is crazy.
Some addicted, drunk loser, and then here you are. I love her every day. She's the best thing that has ever happened to me.
Absolute unconditional love right there.
Anywho, I think she's about due for a bottle.
Yep, she's telling you the bottle.
So we're gonna cut her off. We'll get back to some good episodes whenever.
Yep. Oh,
love it. Love it. All right, guys. Thank you for joining us tonight. And we'll see you next week on the Mental Health Hour.
Yeah. And thank you for all the subs and the bits that came through. We saw them.